I'm Warunie from the Department of Anatomy, Faculty of Medicine, University of Peradeniya. We at the Department of Anatomy conducted a research on the attitude towards online learning teaching in anatomy during the COVID-19 pandemic period among preclinical students in the Faculty of Medicine, University of Peradeniya. COVID-19 has affected the lives of all around the world. The effect on education has been drastic. Schools and universities were closed, and internet and web-based methods came to play a major role in continuing education. When the pandemic first reached Sri Lanka and with the first lockdown, Sri Lankan universities had to shift to online methods of teaching. Anatomy is a highly practical-oriented subject, which involves cadaveric dissections, osteology demonstrations, and microscopy practicals. The lecturers at the Department of Anatomy had faced a huge challenge in delivering these highly practical subjects through the online methods. Theory, practicals, discussions, and tutorials were conducted through conference platforms and the learning management system. To identify deficiencies and to understand the student perception of this learning anatomy via online methods, we conducted a questionnaire-based survey. This was done among second-year students who underwent their first semester of learning anatomy the normal traditional way, while they had to undergo their second and third semesters of learning through online platforms. The objective of our study was to assess the student perception on the attitude towards online learning, prior preparation for online learning, active participation during online learning, preferred methods of delivery of the different components of anatomy, with the view to improve the delivery of this subject matter to preclinical medical students. We used a questionnaire consisting of 5-point Likert scale questions, which was designed using available feedback questionnaires from the faculty and the NET. This was pilot tested among pre-interns who had just graduated from the medical faculty and finalized following consultation with the senior academic staff members of the Department of Anatomy. This was distributed via Google Forms to 185 second-year students who had undergone 2 semesters of online teaching. Descriptive statistical data analysis was performed using Microsoft Excel and Minitab 17 statistical software. A total of 115 Google Forms were received, with a response rate of 62.16%. The age of the students ranged from 19 to 25 years, with a mean age of 21.9 years. 51% of the participants were female, while 49% were male. When looking at how the students accessed online education, the commonest devices used were smartphones and tablets. 86% used smartphones, while 68.4% used tablets, and 41.2% had access to laptops. Internet was accessed mostly by personal mobile data, while 56.5% had access to personal Wi-Fi connections. The overall attitude towards online learning was positive, and most of the students were comfortable in learning anatomy via online platforms. And the majority felt that Moodle or the learning management system was well organized and user-friendly for teaching anatomy. Again, most of the students felt that online teaching is used effectively for anatomy during the COVID-19 pandemic. However, most of the students did not agree with the statement that they prefer online learning anatomy to on-site methods. And more than half of the students felt that the lack of anatomy learning will have an impact on their clinical knowledge in the future. Overall, prior preparation for online learning was as high as 97.4%, and all of the students had their own device for online learning. The majority had a good internet connection for their online education, and most of them made a comfortable home environment before joining the anatomy lessons. The majority also agreed that the lecturers are well prepared in explaining concepts in anatomy for online classes. The overall active participation during online learning was 81.6%, and almost half of the students said that they like to interact with lecturers during online entering classes compared to face-to-face entering classes. And almost all the students said that the lecturers encourage them to ask questions and clear doubts during online teaching hours. Then we looked at the student preferences on methods of delivery of anatomy components via online platforms. The learning management system or Moodle was preferred by most for anatomy lectures, anatomy practicals, microscopy practicals, and practice slide projections. While conference platforms such as Zoom were preferred for tutorials and questions and answer discussions. Then we looked a bit in depth at the student perception on online practical anatomy components. First, we looked at how the students thought of online dissection videos. With the statement, videos of dissected specimens are effective as dissections, 68.4% disagreed. With the statement, surface anatomy handouts are effective as on-site practical sessions, 64.9% disagreed. To the statement, videos of osteology demonstrations are as effective as on-site practicals, 57.1% disagreed. For all these three methods, dissections, surface anatomy, and osteology, the students did not prefer online methods to on-site methods. But to the statement, learning histology is difficult without hands-on microscopy, 47.4% of the students disagreed. Only 29.8% of the students said that learning histology is difficult without hands-on microscopy. 86% of the students agreed that the objectives were covered during online practical sessions. Only 0.9% disagreed to this statement. In conclusion, access to online teaching was mostly via smartphones and personal mobile data. Students had an overall positive attitude towards learning anatomy via online platforms during the pandemic. Online methods are not preferred over on-site methods by most. Learning management system was preferred for anatomy lectures, anatomy practicals, and microscopy practicals, while Zoom was preferred for tutorials and discussions. So as recommendations, we can suggest the lecturers to use recommended online methods of delivery of different components of anatomy to students. And we could suggest them to have a few on-site practical sessions when the COVID-19 situation is under control. These are a few of the references we have used. Thank you.